Many of us have things about our appearance we want to change, and while cosmetic surgery is on the rise, guess what else has been booming? Limb lengthening surgery. Guess what? It can boost your height, your ego, and maybe even your libido. That's right. Joining us now via Zoom is orthopedic surgeon Dr. Michael Assayag and recent limb lengthening patient Raz. Welcome, guys.
Thank you so much for having us.
So, Raz, you say that your height was really a source of angst to you and an obsession for you. Can you explain more about that?
Yes, my height was an issue since I was 25 years old. And with age, the height neurosis was only getting worse. So I knew that physically I may not be that bad, but somehow mentally my mind has exaggerated the height issue. It was to the point that it was almost like a disability. For example, we couldn't even go anywhere outside. Or if we go anywhere and there would be people, rest assured that I would be thinking about height. And if anybody made a comment about height, well, for next couple of days, I would be brooding about my height. And I didn't realize that it was so bad that until my wife noticed it and she told me that, maybe you should go out and see a therapist, maybe see a doctor. And I started to research on what's out there. And then I found this procedure, and it was a horror story, basically, because I read that doctors are breaking their patients' bones to lengthen them. It sounded torturous and barbaric, but I kept looking because my neurosis was still getting worse. And that's where I found Dr. Assayag. And, I'm really thankful to him. He put my fears at ease. He explained the whole procedure, and that's how I got it done.
So you made this big decision, Raz. I mean, this surgery is not small-time surgery. You started going through some of the steps. How were the results with your operation?
Well, I went from 5'4" to 5'7". And I know that some people would say, well, 5'7" is not that tall either, but those 3 inches meant a world to me. It was like a switch was flipped on in my brain. The neurosis was fixed, and I got the best results.
Well, we're so glad that you're happy and it worked out for you. Well, we have your surgeon with us, Dr. Michael. I stated briefly limb lengthening isn't brand new, but I know the way you are doing things now has come light years from the way it was done early on. So can you walk us through that?
Well, you got it. Actually, the first description of limb lengthening surgery in the modern age actually was described around 1903 by an Italian surgeon. But the techniques until the 1950s were not very reproducible, were highly complicated, and really crippled a lot of patients. So since the half of the last decade, what really has changed is the technology. The holy grail of limb lengthening, what really changed the game, was the arrival of internal lengthening devices. They made the procedure so much more comfortable, so much more approachable. It used to be mostly done for reconstructive purposes, and it's true, it's still done for that reason, for that indication. But nowadays, because it's getting more and more comfortable, more indications are expanding.